Thank you for participating in this important overview of the available advanced care planning resources and services for residents of Idaho nursing homes. Honoring Choices Idaho has developed this advanced care planning advocate training to increase the awareness of available advanced care planning resources and the importance of advanced care planning for all adults. Upon completion of this program, participants will learn the basics of advanced care planning to be able to share with residents, recognize factors influencing resistance to participation in advanced care planning. Participants will learn how to invite residents to participate in advanced care planning conversations and learn about best practices in advanced care planning documentation. HCI was initiated in 2016 with seed funding from St. Luke's and St. Alphonsus Health Systems. The initial focus of HCI's work was helping health and community-based settings integrate advanced care planning that targeted healthier adults or adults with a well-managed chronic illness. The goal being to influence culture change, stressing that advanced care planning is important for all adults regardless of age or health status. With a grant from CMS's Civil Money Penalty Funds, HCI has the opportunity to work with Idaho nursing homes to support integration of best practices in advanced care planning. With this new opportunity comes a new focus, focusing advanced care planning efforts to meet the needs of those who are much more ill and or frail. Honoring Choices Idaho uses the Respecting Choices model of advanced care planning. This is an evidence-based program proven to increase the percentage of individuals who have a documented advance directive. This program was developed in the early 1990s through the Gunderson Health System in La Crosse, Wisconsin. Advanced care planning is not a one-size-fits-all, nor a one-and-done conversation. Person-centered advanced care planning must be individualized to a person's stage of illness. It must motivate individuals to participate and must integrate cultural or religious values and beliefs into planning. This diagram represents the common trajectory of a chronic illness, where 80% of individuals will contract a chronic illness that will advance over time and involve a dip or an acute event. The dips are unpredictable, and these events can result in death. Patients who survive the dips typically do not return to baseline health. Each stage of illness represents planning opportunities to address changing needs and goals as one's health begins to decline. Advanced care planning can and should be individualized to the stage of health and woven into the delivery of good health care. Early advanced care planning is advanced care planning for all adults. These are conversations to be had when people are feeling well rather than during urgent or stressful circumstances. The conversation focuses on selecting a well-prepared healthcare agent, identifying goals and values, and determining preferences for a what-if health scenario. So what would someone want if there was suddenly a car accident or a sudden illness? Serious illness conversations involve asking what now. So an individual's plans and goals may change as the burden of their illness advances or becomes more stressful on patients or caregivers. This conversation focuses on optimizing quality of life for those living with a serious illness. End-of-life planning involves asking what matters most. These conversations shift the focus to end-of-life goals and preferences. This type of advanced care planning conversation is relevant when disease outpaces curative treatments and becomes terminal. Our work with nursing homes in Idaho focuses on this stage of planning. So let's spend some time to talk about data. The data help explain the why. Why is this important? Partnering with Boise State University, we wanted to know what Idahoans say about their end-of-life preferences. Replicating the survey conducted in 2006, the 2018 survey of Idahoans indicated that people in Idaho have strong preferences about their end-of-life care. The majority want to die at home, are worried about finances related to end-of-life care, and they're worried about being a burden to loved ones. People in Idaho want to be involved in making decisions about their own death. The majority want to be informed of their health and treatment options and be involved in the decision-making surrounding their health care. Here's some additional data from the 2018 survey. When asked, who would you trust to provide information about end of life? And note that respondents were able to select more than one response. Family and spouse were often selected. But above all, people trust their healthcare providers. However, only 14% of individuals had actually had conversations with their healthcare providers about end-of-life preferences. The model that we're using is the Respecting Choices model. So this is a model with a 20-plus year history originating at Gunderson Health System in La Crosse, Wisconsin. Respecting Choices conducted research in 1995 and 96, and then again in 2007 and 2008 to assess the impact of this advanced care planning model. As a result of the advanced care planning program, they saw an increase in the volume of advance directives for people who had died, and they saw an increase in the advance directives being available in the medical records where the person died. And most importantly, 1 decade later, over 99% of the time, treatment decisions were consistent with the patient's stated care wishes and instructions. Effective advanced care planning really does have the power to transform the way that we provide and deliver care. Let's review some common terms often seen in this type of planning. Advanced care planning is an ongoing shared decision-making process between patients, their families, and/or their caregivers, and/or healthcare providers. Different types of advanced care planning may be appropriate at different stages of life and illness, but they should include the following 3 components: a reflection on goals, values, and beliefs, understanding of possible future decisions, and discussion with identified healthcare agents. Where advanced care planning is the process, an advanced directive is the document. An advanced directive allows you to write down your goals, values, and preferences for future healthcare decisions, and identify who you would want to communicate your healthcare decisions if you were unable to communicate them for yourself. So there are 2 parts. The durable power of attorney for healthcare. This is where you identify who you would want to communicate your health decisions if you were unable to communicate for yourself. And the second part is the living will. This is where you identify your goals, values, and preferences for future healthcare decisions. There are other terms that may be used, may be heard in this type of planning that could include durable power of attorney for finances. This role is different from the durable power of attorney for healthcare. The durable power of attorney for finances is the person who is legally named to make financial decisions only when a person is unable to do so. And the durable power of attorney for finances does not have authority to make healthcare decisions. If an individual is interested in establishing a durable power of attorney for finances, they should be encouraged to seek support and advice from an attorney. as we continue to talk about advanced care planning terminology, it's important to understand the distinctions between an advance directive and the Idaho Post, or physician orders for scope of treatment. So an advance directive is for all adults 18 and older. An advance directive provides instructions for future health care treatments and should be based upon one's values and their goals. It identifies a healthcare agent. It is not a medical order, so it would not guide emergency medical personnel. And individuals can complete an advance directive on their own. They only need to sign and date an advance directive to have a legal document. In Idaho, there's no need for a witness or a notary. And of course, an advance directive can be revoked or changed at any time. The Idaho Post is a medical order. This would be a document that would be for anyone with a serious illness or a limited life expectancy for whom they want to document specific life-sustaining treatments that they would want or not want. These medical orders address life-sustaining treatments such as hydration, nutrition, help with breathing, and CPR. And again, should be based on values, goals, and the current health status. The Idaho Post does not identify a healthcare agent. These medical orders would be followed by emergency medical personnel or other medical staff. And it requires a medical provider to complete the Idaho Post, requiring that medical provider's signature and the signature of the individual or their healthcare agent. And the post can be revoked at any time or changed at any time in consultation with the medical provider. If residents do not want to receive CPR, if their heart or breathing stops, facility staff should document resident wishes in the medical record and contact the physician to obtain an order. This physician or medical order is site-specific, meaning that it guides treatment decisions within the facility only. Do not resuscitate orders are medical orders not to perform cardiopulmonary resuscitation in the event of a cardiac arrest. And it's really important to note that DNR does not mean do not treat. It is specific to resuscitation. A type of physician order or medical order is a post. The post includes directions for other medical interventions in addition to CPR preferences. So let's spend some time to ensure that posts are not misused. It's important to note that federal guidelines for nursing homes indicate that a post is not an advance directive. And the target population for the Idaho Post would be someone with a serious illness or advanced medical condition or advanced frailty at risk for a life-threatening clinical event, or someone who's had multiple unplanned hospitalizations within 12 months, typically with increased frailty, decreasing function, and progressive weight loss. Or it could be someone for whom the healthcare professional wouldn't be surprised if that person died within 1 or 2 years. And again, the post needs to be signed by a medical provider, that individual, or their healthcare agents. So why doesn't every adult have an advance directive? The reality of the situation is that most of us will die interacting with the medical system and may be unable to direct our own care at some point during an illness. Family members who are approached to make medical decisions are often uncertain or unaware of what their loved one would have wanted. Nationally, about 26% of adults ages 18 and above have an advance directive on file. And remember the Idaho data. People trust their healthcare providers, but unfortunately, healthcare providers are not having this conversation with patients. Barriers and fears impacting the process of advanced care planning can be broad. Many people view this subject as difficult or scary, which may lead to a lack of information about options and choices for medical care during advancing illness or trauma. People are often fearful to start a conversation about the what-if scenario, thinking that these issues won't happen to me. How can we change the situation? It's not simply filling out a form. We can reliably change the situation by offering high-quality processes of advanced care planning in a system that is organized and encourages advanced directives to be created. Advanced directives are then made available to the healthcare team in order for clinicians to honor the medical wishes of the individual and to support their healthcare agents at a critical time. This approach to advanced care planning is focused on the conversation, not simply completing a form. Within your facility, individuals will be trained as advanced care planning facilitators, trained to lead individuals through a series of discussions about their experiences, values, and beliefs. This model also includes involvement of the healthcare agent in these types of conversations. Those within your facility who are trained as advanced care planning facilitators will be trained to use general communication skills to promote person-centered conversations, to help guide the conversation with individuals and their healthcare agents. Each facilitator receives conversation guides to elicit experiences, values, and beliefs from individuals, all while allowing the advanced care planning facilitator to remain value neutral in their approach. Remember the image shared earlier describing the stages of planning. Our focus is on that third stage, that end-of-life planning, where the questions really are around what matters most. The training provided to facilitators within nursing homes will help support conversations that include providing information about the role of a healthcare agent, exploring influence of experiences, goals, and values, making decisions about treatment options, assisting with the completion of an advance directive, and confirming that advance directives are stored in the medical record. For residents lacking decision-making capacity, facilitators will learn how to help the healthcare agent think about the individual's goals and values and the types of decisions that that person would want made on his or her behalf. Although some residents may not be able to fully participate in an advanced care planning conversation, this rich conversation helps the healthcare agents or the friends and family consider the goals and values of the individual to help drive the care plans. At a high level, the steps to a good advanced care planning conversation include helping individuals select a well-prepared healthcare agent, the person they select to speak on their behalf if they were unable to communicate. It includes allowing time for reflection. It's critical to consider how goals and values influence decisions related to medical care. Good advanced care planning conversations help individuals connect their goals and values to medical decisions, helping people understand the implications of treatment decisions. And finally, good advanced care planning conversations help support individuals in the process of documenting and sharing their medical wishes. Changes may occur over time, and the advance directive can and should be revised as needed. The most recent signed and dated copy takes precedence over any previous version. Often referred to as the 5 Ds, it's appropriate to review an advance directive after a decade, after a divorce, if there's a death of an identified healthcare agent, if there's a new significant diagnosis, or a decline in overall functional condition. So as an advanced care planning advocate, there are 3 ways that you can support residents in advanced care planning. You can help assess their understanding of advanced care planning. So does the resident have a current advance directive? You can help review advance directives to ensure that they're up to date. You can also provide resources connecting residents with an advanced care planning facilitator within your facility. And you can provide Honoring Choices Idaho education materials. And you may also continue to help assess the understanding of advanced care planning. So as health changes, does an advance directive or physician's orders need to be updated? Introducing advanced care planning can be a role of many staff members within your facility. Honoring Choices Idaho provides this introduction guide to facilities for any staff member to use. Also, another invitation example could be, I have noticed that you do not have an advance directive in your medical record. Have you thought about who would speak for you if you were unable to speak for yourself? After asking these introduction questions, if the individual is interested and they have completed an advance directive, you could share something such as, that's good to hear. I'd like to put a copy in your medical record. If you have your healthcare agent's contact information, I can put that in your medical record right now. If the individual has identified a healthcare agent, but perhaps they haven't completed an advance directive, you could respond with, we have staff who can help you and your agent consider your wishes and complete an advance directive. I can give you more information. If the individual needs additional information or encouragement, a great way to alleviate some hesitation and begin the conversation is with the following. The first step in advanced care planning is picking someone to speak for you if you were unable to speak for yourself. We call that person a healthcare agent. I'd like to provide you with more information about this role. Or we have staff who will help you and your agent consider your wishes and complete an advance directive. I'll give you more information. And this information could be the Honoring Choices Idaho education materials, which are all available on the HCI website. Depending on your role in your facility, you may or may not have a role to support what is done with completed advance directives. However, document creation, storage, and retrieval are important steps in advanced care planning, and it's helpful for everyone on your team to know about this process. An important question that your site will have to consider is how will copies of advance directives be provided to the healthcare agents? After an advance directive is completed, it needs to be stored in a reliable location that allows for it to be easily accessed if needed. So how are advanced care planning documents stored and retrieved in your system? How are notes related to advanced care planning captured? Are there ways to improve this process? I urge you to consider how you can help support this process. These 5 core promises are the benchmark for advanced care planning upheld by HCI's partners. Promises to our patients, constituents, and residents. So number 1, we will initiate the conversation. This is where we invite people to participate in advanced care planning. Promise number 2, we will provide assistance with the process. This is definitely a role of the advanced care planning facilitator to help with that conversation. Promise number 3, we will make sure that plans are clear. So those advance directives that are completed, that they're clear and usable by the healthcare agents and by healthcare providers. Promise number 4, we will maintain and retrieve these plans. So as discussed with whether it's the electronic health record or the medical record, how are advanced care planning documents maintained and retrieved? And promise number 5, we will appropriately follow these plans. And this is the ultimate promise to honor people's wishes. So you are part of this statewide effort, and we thank you for your support. Advanced directives are available on the HCI website in English and in Spanish. These advanced directives parallel the value-neutral topics that residents are guided through when participating in a conversation. So we suggest that you spend time on the website to become familiar with the tools available, including the education guides. Upon completion of this webinar, please email Lindsay at Honoring Choices Idaho to receive a link to a brief quiz, and this will certify your completion of the webinar. Thank you for your time and for your efforts.